Huntington families, get ready to smile. We are incredibly grateful to partner with Jim Hughes, his remarkable wife Leanne, and the incredible practice that they've built here in Huntington. They've been remarkable pillars to their community and have practiced in Huntington for over 25 years, all through patient-focused and patient-centric leadership. So stay tuned for more to follow on that. But this video, we're going to talk about what goes into kind of a dental transition or a dental roll-up. Thankfully, Dr. Kevin DeKine, who has been our remarkable dentist in Peru for almost 3 years now, is going to pivot to the Huntington practice. He lives in Warren, so it's right down the street for him. So he's really excited, and he and Dr. Hughes actually know each other going all the way back to dental school. So really cool, kind of full circle story, and really excited for this opportunity. But what goes into a kind of dental roll-up are just these factors, and this is just the tip of the iceberg. So these are the things that we've been doing for Huntington and are going to continue for the foreseeable future, just as a lot of this stuff takes time. So first and foremost, practice management software. We're going to have to convert that. So we use Denticon. It is cloud-based. A lot of clinical benefits for our teams there, being able to access their schedule from anywhere, and a ton of patient benefits as well, as they can set up online patient portals and a lot of cool features that our software is able to provide. Next, switching over the utilities, that fun stuff, Comcast, phones, and you have to do it the right way so you don't lose the office phone number, the fax number, all that stuff that are linked to insurances and linked to different things. You want to make sure you're able to keep and claim those phone numbers, and again, doing that in the right manner is very important. A lot of that takes time. And on this one, like for utilities, for instance, this pivots also down to our dental equipment and supplies. Well, we're going to put in a new pano at the practice in Huntington. Well, right now it's only set up electrical at 120 amp. We need 240. So we're gonna have to run new wire and set it up so we can have 240 volts there to make sure that we have enough capacity to run that pano machine. So some of those things, new sign. Clifford Signs does a great job for us. We will be doing changing over the signage, but we also have a little bit of a question of if there's going to be some electrical work that's needed there. So some of this stuff you don't really even know until you go live. So for you guys at home, Clifford Signs will be doing the new sign this Friday. So and just a lot of stuff. We partner with Patterson. Ryan from Patterson's been great for us. We are going to be getting the office set up with basically all new supplies and equipment. So the team should be really excited. I know our patients are going to be really excited. So and shout out to Ryan and the Patterson team for getting us squared away. That's a big undertaking. There's a lot that goes into that. Credentialing and insurances, so getting Dr. DeKine credentialed with all the insurances that we take insurance in a lot of dental insurances, so getting all credentialed there, as well on the back end, getting our insurances set up with kind of office insurance and liability insurance, malpractice insurance, all of those different clauses you have to have squared away. Signage and market, we talked about Clifford Signs a little bit, but in terms of marketing, we sent out a patient letter going back to the last 18 months of patient visits, just to educate our patients on this transition that's happening. A lot of marketing in terms of web presence, so getting us up there on the social medias, getting us on Google, all of those things, and a lot of that stuff you can't do until you take over the practice. So you can build a little bit of that infrastructure, but really can't go live until you can claim those practices. And then lastly, and probably the most important part of the whole process is the onboarding, i.e. or recruitment. So thankfully the awesome hygienists in Huntington are going to stay on, and we're incredibly grateful to get to work with those talented individuals. Leanne is going to retire with Dr. Hughes, so we are going to be hiring a practice manager and some dental assistants there, so really excited for that. Kelly and our HR department and Mary are jazzed up and invigorated to kind of get have some interviews and spread the word. So that's always a fun process. So as you can see, a lot goes into a dental roll-up, but if done well, they can be pretty smooth. There's always a hiccup or two, always, but that's been the plan of attack for us so far. And for everybody at home, please come out this Saturday, June 29th, for Dr. Jim Hughes' retirement party. That will be from noon to 2 p.m. So look forward to seeing everybody there, and have a great Monday, guys. Again, this Saturday, noon to 2 p.m. Dr. Jim Hughes practice. Look forward to seeing a whole bunch of smiling faces. Cheers.